Now, this next article, if it wasn't getting on my nerves enough, fearing coverage could change, some parents rush to vaccinate their kids. That's the article. This is July 25th. All recent, right? For 2 decades, Washington, D.C. pediatrician, her name Lanre Falusi, has counseled parents about vaccine safety, side effects, and timing. But this year, she said, the conversations have changed. For the first time, I'm having parents of newborns ask me if their baby will still be able to get vaccines, Falusi said. So there's your key here. Still be able to. Whenever somebody wants you to make a bad decision, they're going to stress that it'll be gone soon. Like that it'll be run out soon. Like buy now, supply limited, limited time offer. No matter what it is, that whenever you get the idea that something is about to run out or maybe it won't be available, that's when you get people rush into the stores to buy toilet paper like happened 5 years ago. So manipulators, what I want to do this, they introduced the concept of lack because it works on our human fear of abandonment and exclusion, which we have as human beings. Furthermore, this is one of the many things that has occurred due to the second Trump presidency. And I called this happening. And with RFK as well. I'm not sure, honestly, many people have talked about this. But and if they have, it's worth mentioning anyway, that this urban and suburban American majority, right, which is leftist or centrist, the status quo we're talking about, right, at least the left-leaning status quo, which is most of the academic communities, most of the middle class, that's what it is. Now these people, which is really a majority, they've had an existential fear triggered within them due to the Trump government and the Trump administration. They're feeling the same way right now as you would feel, if you thought your child was about to run out of food. Like they might not have food tomorrow. That's the way they see vaccines. That's the way a whole lot of people see the medical community. That, like we're going to go back to the dark ages if this is gone, right? Back to the article. Throughout the U.S., pediatricians say that anxious parents are concerned about access to routine childhood immunizations. Exactly what I said. It's anxiety. It's just like food insecurity, right? That's especially true for those with children covered by Medicaid, the government insurance program for low-income families. Medicaid covers 4 in 10 children in the United States. Now this person, Deborah Greenhouse, a pediatrician in South Carolina, she says it really became an issue when RFK Jr. stepped into the role of HHS secretary. And I mentioned this before. It's just another indication, it's just another explanation of why RFK was allowed to get in the first place. Because the fact that he's done formal work about vaccines, he's made the documentary, and because of his presence there now, his work that he's done in the past, and then the current statements he's making now, this mobilizes all these people to double down, to connect even more deeply with the scientific and medical systems. The doctors, the universities, the drugs, the insurance, all of that. They will trust it even more because they think this threat is coming to take that away from them. Then the article says the concern accelerated after the shakeup of a key Centers of Disease Control and Prevention vaccine advisory body in June, raising fears that millions of American families could soon have to pay out of pocket for shots now covered by their health insurance. And that's the point here. Raising fears. They say raising fears. That's what the point of it. Now, if vaccines are really going to stop being covered by insurance, they may make some things out of pocket, but not to any significant degree, because the insurance companies and drug companies and government, they're not going to step on each other's toes. That's a real, very delicate ecosystem there. You know what I mean? Like, you're not going to shake that up. Plenty of people think that an old man can just come in and start changing all of that around. I think you are a bunch of fools if you believe that. He wouldn't stand a chance. You're not walking in and going to change around all those long partnerships and contracts and entanglements that you don't even know. It would take years for you to even figure it all out. So please get this fantasy out of your mind that politicians are going to be coming in and making significant changes to established systems, because they're not. You might be able to take the transgenders out of college sports, yeah, but you ain't touching shit, Bobby, when it comes to insurance, pharma, and government deals. He's not touching it. And neither is Trump. Donnie and Bobby are not touching shit when it comes to big money like that. And it's not even about money. It's about entire systems of market control. Like, we're talking about making markets. So we're not talking about somebody who's made a couple billions even in real estate. We're talking about the market, the future of the real estate market. There's levels to this shit, as they say. Now let's finish up with this article. Health and Human Services Secretary Robert F. Kennedy Jr., a longtime anti-vaccine activist, removed all 17 members of the CDC's Advisory Committee on Immunization Practices, or ACIP. Now, the ACIP is the panel responsible for recommending which shots are included in the nation's adult and childhood immunization schedules. Kennedy replaced these panelists with new members aligned with his views, prompting alarm among medical professionals and public health experts. So he reshuffled people, just like the cabinet changes and all of these appointees to all of the organizations change with the president, right? But that's exactly my point here. So he gets his people in. They get their people in. But what does it matter what people they get in if these people all have the same length leash? They're paid by the same people. So who cares what they are? It's just like the politicians who get voted in. They're still getting funded by the same organizations. Now these bureaucrats that get appointed, not voted in, they're still paid and sponsored by the same type of organizations.